the community. A lot of people, one, do not even know what we do. Because they don't know what we do, they don't know the services that we offer. So when it comes to the community-based support and advocacy, we're lacking. We're not there actually helping people, provide people with the education that they need. We're not there giving the patients the care that they need because they don't know. So when I say in the community, I'm talking about boots on the ground. I'm talking about, yes, we need to be more so as primary care providers. We need to be more so be in these clinics. We need to be in the emergency rooms. We need to be in the hospital settings. We need to be just stepping outside of what people see as traditional acute care physical therapists or outpatient-based physical therapists, because the outreach portion of it starts when people recognize, and we recognize, that we're more primary care providers. If we're able to better educate and advocate within our own communities, then people can know what care they're missing out on, and we can help the profession grow. We need to be at workshops, we need to be speaking and advocating so that way people are able to recognize the care they're missing, the care they're lacking, and if we're able to do that, then that can help the profession grow. But when does that start? It starts before you even finish PT school. A lot of students don't recognize the opportunities that are present for them simply because they're not exposed to it. They're not recognizing that there's more work that you can do outside of the clinic. There's more work that you can do outside of you wearing that name badge. But every moment you walk out, every moment that you're involved in engaging with people and having basic conversations, that is a way we can help the profession grow. Without those simple conversations, people will never know or fully understand what we do. I actually have a family member, she's a nurse practitioner, and over Thanksgiving we were talking about, our different professions, and she was shocked to find out. She says, wait, you all treat women's health conditions? Yes, we do. And we were talking about some different things that some of her patients were experiencing, and I said, you really need to find a physical therapist in your area. They can help with this. And then randomly she mentioned that her mom was having lots of dizziness. I said, well, do you want me to take a look at her? She says, why? Because I treat that too. And she had no idea because the communication's not there. So how can a profession grow if other providers don't even know what we do? But also, students coming into school don't know what we do. They're shocked to find out that you can go into so many different areas, that the specialties are so widely and vastly different. But the only thing they know coming into school is, oh, I want to do pediatrics, or I want to do sports and orthopedics. Those are it, that's it. People don't realize that there's so many different avenues, so the profession can only grow if we actually begin speaking about what we do and holding true to our expertise.